All right, guys, we'll start it off. So, good afternoon to everyone, all the participants, and anybody who's joining in while I'm saying this. This is our final presentation. Thank you to those who have attended any previous ones we've had this month. My name is Dimitri. I was part of the first one. I'm a senior safety consultant at Recovery Partners, and I will be hosting today's event. And my colleague James will be delivering the content. James is also a senior safety consultant at Recovery Partners and has been there for over 3 years now, serving a number of clients from a range of industries that present a number of issues that expose workers to injuries, and obviously trying to mitigate that. Today's topic, here we present strategies in preventing musculoskeletal injuries. It is our final one. As part of today's presentation, I encourage your full participation. And what I mean by this is take notes, write down questions, even if you write them down in the chat. Brainstorm as you're listening to, ideas can pop into your head. And at the end, we'll allow some time to obviously address those questions and interact. And you never know, your experience may help somebody else with an issue they're having. Again, thank you for dedicating time out of your day to further upskill, maybe refresh your awareness in health and safety in your industry during our final talk from Recovery Partners on Safe Work Month's presentations. James, all yours, mate.
Thank you, Dimitri. Yeah, so obviously today we're going to be talking about preventing musculoskeletal injuries, but we're mainly going to be focusing on musculoskeletal injuries outside of the workplace, which is what I've been a focus on for the whole month. So just a little bit of background to me as well. So I'm a accredited exercise scientist. So I've worked with physiotherapists for over 6 years. That was my previous role. And now I've moved into work health and safety. So I've kind of seen with musculoskeletal injuries in particular, kind of seen them on both ends of the spectrum. I've seen it where you're in that rehab stage, trying to relieve those symptoms of pain and discomfort. And now I'm in the stage of trying to prevent and look for hazards in workplaces so you can prevent those injuries and illnesses for occurring.
Nice.
Thank you. So, what we're going to go through today is a little bit of a background on how musculoskeletal injuries can occur, how injuries can affect the workplace, how to reduce the risks of injuries, and then how those injuries may impact our mental health, and then last of all, how we can support our workers in the workforce. So hopefully out of today, we're going to get a little bit more of awareness on how musculoskeletal injuries can impact workplace safety, and how we can apply maybe some strategies to help support our workers, and thinking of preventing injuries as a collaborative approach rather than just thinking about preventing the injury itself. All right, so to start off with, just thought I'd run you through some statistics. So 7.3 million Australians, they're suffering from chronic musculoskeletal injuries, or skeletal conditions, I should say, at the moment. So that's over a third of Australians, over a quarter of Australians are currently suffering from musculoskeletal conditions. So maybe that might be more than what you thought it'd be. The top two are back problems and arthritis, which we're going to go into a little bit more detail on. So if we bring that scope a little bit wider now, and if we're looking at chronic health conditions, it's 8 in 10 Australians suffering from a chronic health condition, so about 80%. So the top three there are mental health, which is a growing space, as we all know about. And then the other two down the bottom there, the two I just mentioned, so back problems and arthritis. So we're going to go in a little bit more in depth about how those three can all relate to musculoskeletal conditions. So risk of injury and illness. So when we're thinking about what personal risk factors, so what risk factors about ourselves or maybe about our employees that may increase the risk of them potentially sustaining an injury or an illness. One would be their physical fitness. So obviously how fit they are. The other one would be past injuries or illnesses or current. So if they've had an injury in the past, it's going to have a greater risk of them exacerbating or re-injuring themselves. Same with illnesses, whether they're carrying those sorts of illnesses. Eating habits as well, so their health, the type of physical activity they might be doing, attitude towards health as well. So, maybe younger generations think they're a lot more bulletproof than what our older generations are. And then age as well. So unfortunately, none of us are getting any younger. And as we go through life, those niggles and those aches and pains we feel a lot more as we age, which is just a part of life. So there are two types of injuries or illnesses that we can incur. So first one is acute injuries. So think of acute as something that's quite sudden, and you know exactly what's happened. So I'm not sure if anyone's ever rolled their ankle before, but when you roll your ankle, you pretty much know exactly what you've done. You know exactly where the pain is. You know exactly where the swelling is, and if you go to get some treatment from a doctor, from a physio, you can pretty much tell them exactly what's happened. Same with a short-term, say, illness, so like a cough or a cold, lasts maybe for a few days. You get a few symptoms and they go away. In a short period of time. So chronic is completely different. So I like to think of chronic injuries and illnesses kind of the sneakier ones. So we don't really know they're happening until maybe one day we experience that really sharp pain or that really bout of discomfort, and it really impacts us. So things like your lower back. So when we use our lower back, we're moving a lot throughout the day or throughout our life, and maybe up until lower back injuries are quite prevalent with people that are over the age of 40, so in their middle age. So when we experience a little bit of life, a little bit of movement, that's when we see our back start to deteriorate. So we don't really know that that's happening until we get that later on. Same with illnesses. When we get into those bad habits with our health and everything like that, we don't really know what the damage is until later on. And then it takes a long time for us to get on top of that pain, discomfort, and for us to get back to where we once were. All right, so we're just going to go through just a few health conditions. So from the top three were mental health. The top one, the most prevalent was mental health was our most prevalent chronic health condition that Australians are facing at the moment. So mental health, it affects the way we think and feel. Okay, so there's over 200 types of conditions, but the top two are anxiety and depression, which most of us may have heard of before. So how does mental health affect our musculoskeletal system? Probably the top one is if we're feeling really stressed and anxious, our muscles are going to tense up. So most of us, we carry tension through our neck and our shoulders. So I'm not sure if anyone's had, say, a stressful week, stressful period of work, or maybe even their personal lives. They feel like they've got a little bit of tenseness around their neck and their shoulders. Could be from stress. Okay, so that's where that interlinks as well. The other most prevalent one is something that's called psychosomatic symptoms. So what that means is if we're currently experiencing some discomfort, maybe in our body, and we're feeling really anxious and really feeling really anxious about that injury, that anxiety tends to exacerbate those pain symptoms. So, for example, if I have a lower back injury and I'm feeling really anxious at the moment, I'm going to be very, very careful about about how I use my back. So I might be really stiff in my movements. I might be really worried if I'm going to be doing any sort of movement with it that I'm going to feel pain. So the more you think about that discomfort and that pain, the more that pain is going to be there. So it's really about training your mind about how to trust your body whenever you're, I guess, rehabbing back from an injury. Cool. So moving on to spine. So back problems was the second most prevalent. So usually with back problems, the most common one is the degeneration of the spine. So what we're looking at here is MRIs of a healthy spine, so in the green there, versus a degenerated spine, which is that picture on the right in the red. So you can see the differences between the two. So the blue is our disc, so that allows our spine to move and for mobility. So you can see the difference between the disc is worn down. So as we use our spine, okay, over a long period of time, that disc starts to wear down over time, okay? Those crackling bits, that's what we call arthritis. That's what arthritis looks like on an MRI. So this is a natural thing that happens over time. So unfortunately, we can't stop this degeneration, but what we can do is we can slow it down, okay? So through keeping healthy, through maintaining our physical fitness, we can slow that degeneration down. So we're not experiencing that pain and discomfort until we're later on in life. And the last one we'll go through is arthritis. So arthritis is inflammation of the joints. So fun fact, anything with itis at the ends of it means that it's got something to do with inflammation. So how do we treat arthritis? Is we can take medication, we can do some low resistance training, we can have surgery. So if anyone's ever heard of someone having a knee or a hip replacement, or you can do some alternative treatment there. So yeah, preventing arthritis, just keeping healthy, doing some strength training, so keeping strength in your bones and in your muscles, and focusing on your health as well, so limiting those smoking and alcohol factors. Okay, so how does this all relate to safety? So workplaces are really good at identifying hazards within their workplace and then putting risk management strategies in place to be able to reduce the risk of those hazards. But what we don't think about is, what are our employees experiencing outside of the workplace? So with relation to our musculoskeletal system, it could be our physical activity that our employees are doing outside the workplace. And then how is that impacting when they come into the workplace? So what impacts that could have is, if they are experiencing some sort of injury or illness, they might not be able to perform, say, a safe work procedure as well as they should, because their mobility is impaired, especially if they're doing some sort of physical labour. The other one would be they might have a tendency to report injury or illnesses, as they're currently experiencing pain and discomfort themselves, and they haven't reported that to the workplace. They may not feel the need to report maybe a minor or an injury to the workplace, and that can create a hazard, as a workplace may not know about injuries and illnesses that employees are experiencing out there on the field. And the last one, so the other one would be using annual leave for injury recovery. So we all want our employees to use, say, their annual leave for their own personal benefit, to really shut off work and go on holiday and do the things that they love doing. We don't want them to use annual leave for their injury recovery, because that can impact that mental stress and that mental load. So that's how it can really impact their psychosocial health, which is what we need to really consider with that new legislation coming out. So if we take sort of a risk management approach, so the same risk management approach that if there's a hazard in a workplace, we're going to, first of all, identify the problem, and then we're going to do a risk assessment, and then we're going to figure out what's the best strategy. So for external factors for musculoskeletal injuries, we still use that same framework, okay? So we first of all need to identify the problem. So we need to see, are my employees really at risk of sustaining, I guess, musculoskeletal conditions outside of the workplace? So how do we get that information? So it's largely from really just getting to know your employees. So really leaning on your HR departments or your people and culture departments about any information that they've gathered about employees when they've first been onboarded. Maybe really making an effort every time you speak to an employee, asking them something, how their weekend was, or any interests they have, just getting more information you get. The more information you get, the more information you have to really try and risk assess, or maybe develop some strategies to help prevent those workers from having a musculoskeletal injury or condition. Okay, so once we get that information, then we can collate that information and start to think about, okay, rather than just me helping one individual, how can I help my whole workforce as a whole? So are there any similarities between maybe people's physical activity when they're outside of work? Okay, so when I say physical activity, it doesn't just mean people that are doing exercise, people that are participating in sport. Physical activity can be housework. Physical activity can be it's getting warmer now, so more people are going out in the gardens and doing weeding. And I know I've been out in my garden and chopping down branches and trimming it all up, so making it all nice for when people come over. So doing activities like that's still physical activity. So it's thinking about everything that can encompass us being physically active. So thinking about, are there similarities? So are there employees that have maybe similar limited capacity, physical capacity? So that could mean someone who is experiencing maybe an injury. Have we got employees maybe experiencing some similar injuries? Maybe we could have a think about a strategy around that. It could even be if we have a high percentage of women in our workforce, and those women may be looking to get pregnant, or they are pregnant at the moment. That's still something that's limiting their physical capacity. So that it's still an avenue for, say, a workplace to go down to try and help and support their workers through that time. All right. So once we develop and we're thinking about, okay, we've got some similarities between our employees, and now we're starting to think about how we can start to prevent those strategies from happening. So not sure how many of you went to our last presentation about risk management, going through the hierarchy of control. You can still apply that hierarchy here. So how can we help? One is potentially doing a pre-employment screening. So pre-employments, they're a really good way of, before an employee goes into the role, what's their physical capacity like? What are their risks? So what are they going to be able to perform the job without inherent risk? Okay, so it takes the onus out of, say, a manager or someone who's employing an employer to make that decision. We want to get those decisions into the right hands. So people that are medically trained to be able to make those decisions for us and to be able to say, yep, this is someone's physical capacity and we think they're going to be okay for this role or not. So pre-employment screenings are really helpful in that sense. The other one is really popular is wellness programs. So there's a lot of different wellness programs out there that you can implement that can help workers improve their health. So a really good one is doing a pre-work warm-up or a stretch. That's a really good way of everyone getting together and doing some exercise all in a group. And it also does a lot for reducing those niggles and those pains as well. Another good one would be maybe getting someone externally coming in, and say if we have a lot of women maybe that are about to be pregnant or they are pregnant at the moment, maybe you might want to get someone in to educate them on maybe the first stages of pregnancy and how to control all those vital information that they need through that time. You might even do, say, an exercise class, so yoga, Pilates, to get employees maybe introduced to these types of things that they wouldn't normally do themselves, and they might even enjoy it. So trying to get them involved in that way. So there's a lot of different ones out there. So I guess it's what's going to be the most suited to what you've decided on is going to be the best solution there. Here's a bit of a warm-up guide. So as Dimitri has said before, we're going to send this slide out. So this is a few exercises that you can try if you're looking at doing, say, a warm-up session with your employees there. Suitable duties. So we know suitable duties are mainly reserved for injuries that occur within the workplace. But if there is an opportunity that perhaps a worker needs some support from the injury that occurred outside the workplace, potentially there could be an opportunity for a workplace to offer a suitable duty, even though our injury hasn't occurred in the workplace. It just shows that workplace is really, encouraged to support that worker. The preparation is key as well. So encourage. So you might do a toolbox talk, or you might have a meeting about maybe preparing for exercise, or maybe preparing your body to go through. Maybe some workers are about to have some sort of surgery or something like that. So even preparing your body for surgery. So doing some exercise or some strength training to help keep that strength to help them recover better from that surgery. Or it may even just be if we have a workforce that all of my employees are currently doing some sort of physical activity or exercise or sport outside, you might just say, just remember, make sure you plan where you're going. If there's weather conditions, prepare for that as well. Maybe also prepare if something goes wrong. So if we have a lot of employees, say, into cycling and they're going on long cycles on the weekend, just say, hey, there's a bit of rain coming about. Maybe just make sure your bike's all good to go, your tires are pumped up, you got all your pliers that you need to go, and hopefully you go well on your ride. So getting that thought into employees is important, so they're not just going out and getting right into their physical activity without even considering any preparation. So mental health effects. So with injuries, as we know, they stay with us until we can start to rehab and get on top of that pain and discomfort. Okay, so what that does is that prevents us from doing the things that we love doing. So if it's us with a young family, maybe it prevents us for having playtime or getting out and experiencing those one-on-one times with our kids, or going away, doing travel. So a lot of when we're traveling, we do a lot more walking, we do a lot more physical activity. So we just need to consider that when we're thinking about these strategies as well. So here's another couple of things. So obviously there's if people are suffering from mental health, you can offer your EAP. If you're not willing to offer EAP for external services, there's Beyond Blue and Lifeline Australia. You can educate your managers and your supervisors for dealing with psychosocial reactions. And then maybe if you do have recommended physiotherapists, GPs that you may use for your return to work program, maybe offering them out so workers can go to them if they are respected and you guys think that you've got good results from them, giving that to your workforce and say, hey, these guys are good and getting so they're getting the best care that they need. So that's that will pretty much wrap up for today. So yeah, if anyone's got any questions, the chat's there, or you can come off mute. So yeah, fire away, guys. If you got any questions.
James, I want to say that was awesome. For me personally, it's just a gentle reminder about the things that are going on outside of work, and we have to consider them both physically and mentally. And the biggest takeaway for me personally was the stress, anxiety outside of work that could be leading to your body tensing up and causing more injury. So that was a big one. But yeah, we'll go to the floor. We'll see if we got any questions from the participants. Just while Ben is typing, I got a question for you. If someone's already employed, can the employer send them off for a health assessment?
Yeah, absolutely.
Yeah.
100%. Yep. Yeah. So yeah, health assessments don't have to be pre-employment assessment. You can assess a worker's health if you feel they are at risk whenever during that employment. Absolutely.
Yep. Here's one from Michael or Mika. How do you get around the issue where staff think we are prying into their personal lives when asking them about activities at home?
Yeah. So, well, I guess it goes down to the relationship you have with your employees. So, when we're asking, you may do this informally or you may do it formally. So, when you're asking questions about things that they're doing on the weekend, it might not be. You might not ask directly what physical activity you're doing outside of work. You might just say, "How was your weekend? Maybe what did you get up to, or maybe what are you any plans outside of work?" And hopefully they might say, "Oh yeah, I'm going for a run tonight," or "Yeah, I'm doing this. I'm getting out in the garden this weekend because I got people coming over." So it's really just tuning your ears, maybe to think about whether they do give you a little bit of an inkling into what they are doing. But yes, there is an aspect of not really asking directly about the answer that you want. So I guess it's just asking those really open questions, getting them to talk, and then you listening and seeing if you can listen for anything that they've I guess said that may indicate their physical activity outside of work. Yeah.
Nice. I second that as well. And the other thing is, as James said, it's the relationship that you have. So sometimes it's actually a matter of sharing what you're doing in the weekend or how you're staying physically fit that allows that conversation to open up in them sharing what they're doing. So that's a really good answer, James. Anybody else? Any other questions?
So from Ben, so what happens if your work hasn't got time to exercise before work? Is that saying that? Does that mean what if employees don't have time to exercise before work? Well, that means they can exercise in other times, maybe on the weekend. So, yeah, I think is that the answer you're looking for there, Ben?
It's interesting as well. I think for in those situations, it's kind of sort of doing a self audit where you have time, when you have time. But again, if your employer is providing those monthly challenges, Septembers, anything else like that, it's a really good opportunity to start to engage in them if you can't stay active. Obviously, there's weekend work, but it depends if you do shift work or whatever it is. But yeah, I think in those situations, and I'm just talking from my experience from back when I was a personal trainer, is doing a bit of a self-time audit to see where you can, when you can. And the most common thing is people think, oh, I need an hour, 90 minutes to exercise. No, James could agree here. You 15 minutes, you could get a lot done. 20 minutes, 30 minutes, walking your dog at a faster pace, hanging out with your kids, obviously staying active as much as you can. But yeah, I'd say self-audit and try to find that time.
Yeah. So Mika's saying any health challenges you recommend? September's a good one.
Dry
so
July.
I know that's just passed, but that's a really good one. I think a lot of workplaces get around that. I know, not sure if anyone knows who Ned Brockman is, but they do. But he's just starting a challenge where it's 10 days of doing something uncomfortable. So you might want to challenge your workers to maybe step outside their comfort zone and challenge themselves in a different way to make them uncomfortable. Could be physical, could be anything, but that can help people's, I guess, musculoskeletal system. It could be something as simple as if you have a regular meeting, maybe throughout the week, maybe every month we say, okay, this monthly meeting we're going to do a walking meeting, say, and you might do an online walking meeting, or something like that. So yeah, there's a few out there. But yeah, if you want us to get us a list up, we can do that.
Yeah, you can reach out to a provider like a yoga instructor, for example. We had this at Recovery Partners where for 4 weeks in a month on a Friday, towards the end of the day, we had a yoga instructor take us through some relaxation. And to be honest, a lot of us relaxed and sometimes fell asleep. But it's really about setting that goal and brainstorming and seeing, is it appropriate for my workforce, and how do we implement it? Yeah. Megan's had another question just here. When completing a pre-employment assessment, how do you prevent the chance of discrimination towards their health?
Yeah, so with pre-employments, I know what you're saying there. So pre-employments, the reason why they're good is because, say you have a role, okay, and say it's a role that requires maybe some sort of physical effort. So say it's someone in a warehouse. It doesn't have to be. It can be someone that's doing office work as well. But so from a workplace point of view, what you're saying is we need to make sure that the worker that we employ is going to be suitable to be able to perform the tasks that are required within that role. Okay, so a pre-employment, what I guess a medical assessor does is they do the assessment themselves. Then they report back to the employer and say, yep, we think that they're okay or they're happy to do it. And maybe if during their assessment, they may have picked up on maybe one or two things that they think could be at risk of the employer suffering maybe an injury or illness in performing that role. So it's not when they do the pre-employment that they go through the whole medical history and they go through all the injuries and then that's reported to the employer.
Yeah.
It's the medical assessor will only report something that's relevant to, I guess, that role or that position. Okay, so it's not by any means that if you're going to say to an a potential employee, they have to do a pre-employment health. There's still confidentiality there.
Yeah, no, great answer. Tracy's just added something. Pre-employment is to ensure the person is fit for purpose, and this helps eliminate the risk of that person, if not to standard hurting themselves. So it really comes down to duty of care. Yeah, or hurting others. Yep, that's true. Yep, very good.
Correct. Yeah.
And Megan had another suggestion: chair yoga. There you go. So there's probably a couple of things you can find in that department of what's happening. There's really no rules, I'd say, as long as it is safe and there's no pressure to complete it. But come up with a list yourself, brainstorm some ideas, research, see what other industries are doing successfully, and then see how you can implement it. Any other questions, guys? If there's no more, again, I want to thank you all for attending again. I want to say thank you to James for giving us a really good presentation. You reminded me of something, James. There's a quote: awareness precedes clarity, clarity precedes results. So you've made us aware of a couple of situations, a couple of things for ourselves, for our employees. We've got some clarity potentially in which direction we want to use this information and where do we want to take it. And hopefully for everybody else's benefit, there are some results, this month, next year, in the way we implement preventing injury. So thank you, everyone. James, a lot of thank yous coming your way. And
thank you.
Appreciate
thank you, guys. Thank you for coming on. And hopefully you got something out of that.
Beautiful. Cheers, guys. Enjoy the weekend. Happy holidays.
Thank you.
See ya.